Good morning and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. Going to be speaking with Dr. Maxime Descoteaux this morning. He's joining us here from INmeka, and he's going to talk about white matter versus gray matter when it comes to evaluating Alzheimer's disease. Welcome to Health Professional Radio, Dr. Maxime Descoteaux.
Thanks for having me.
Well, I did say that you were here from a company called INmeka. Give us a bit of your area of expertise and talk about your role at INmeka.
Yeah, Imeka is a company based in Sherbrooke, Canada, an hour from Montreal, so we're in the east coast of Canada. And we also have an office in Boston, in Cambridge. And what we do is we bring an image analysis services to the pharmaceutical industry and biotech companies. And what we're trying to do is understand how white matter degenerates with brain diseases such as Alzheimer's disease, Parkinson's disease, and other such disease. And we have a very unique technology to be able to non-invasively image this white matter so that we can quantify the effect of a drug or a molecule on white matter and brain damage in general. So that's what we do, and that's our expertise.
White matter versus gray matter. Is it white matter or gray because of the way that it shows up in imaging, or is it actual white matter in the brain itself and gray matter in the brain itself?
A little bit of both. Actually, white matter is all the wires and the cables that connect different regions of the brain. And these wires are surrounded by a myelin sheath, a little bit like your cables at home are surrounded by a plastic or little plastic sheet, and this is a white color. So when you actually do a dissection or an operation on the brain, you see it's a white color, and it also turns out that on MRI images, so that's magnetic resonance imaging, on anatomical images, the white matter is a little bit more white and the gray matter is a little bit more gray. And just so that people understand, the gray matter is a bit like our cities or computers in our brain, where a lot of neurons live. So the cell body, the neurons, is in the gray matter, and a lot of computation goes on in the neurons. And the neurons are connected together via white matter. And these are the cables, the wires. And this is more than 100,000 miles of roads and wires connecting different regions of the brain. And this is the distinction between, white matter being the cables and gray matter being the little neurons and the little computers making computation.
Why do you think traditionally the focus has been on gray matter, and why now this switch to white matter when it comes to analyzing Alzheimer's? Well,
historically, it's been a little bit easier to see gray matter. Actually, with aging, we see that we lose gray matter, and it's obvious in the images, a little bit like our muscles atrophy with age. Gray matter is thinning. We have more liquid in the brain, and one of the key centers of memory is a little gray matter area called the hippocampus. It's actually in the shape of the hippocampus like we see in the ocean. And this is a little gray matter area that's in charge of memory. And so a lot of attention has been devoted to this little memory center for the past 20 or so years. Since, I would say, 10 to 15 years, we've had the appearance of a technology to map the roads and the connections around these gray matter areas. And what we start to realize is maybe all these brain diseases is actually a little bad wiring. They're wiring issues. There are potholes on these roads. These roads are starting to deteriorate. And then we don't know what comes first. Is it the roads that deteriorate that lead to problems of the hippocampus, or the other way around? The hippocampus is starting to deteriorate, which affects the roads that it's connected with. And that's what is really cutting edge right now. It's actually challenging the current models of just gray matter being implicated and actually looking all around the gray matter with the novel ways we have to map. I always say it's like mapping the Google Maps or the Google Roads, the street view of the brain. if we understand how the brain is connected and disconnected with disease, and how these roads are being affected with their integrity, maybe we can better understand disease and what's going on with Alzheimer's disease in particular.
You talked about muscles atrophying as we age. Some of these muscles with use and exercise don't atrophy as fast. Now, you talked about the brain atrophy, more water on the brain, as it were. Does the imaging technique or technology change as the brain ages to detect certain things, or do you use the same imaging even though, as you say, there's more deterioration and water on the brain?
It's the same technology. We just look at different things or under different angles. Mm-hmm. We use the same technology to see how the brain develops actually in babies and young adults. And, why is the brain of a pianist different from the brain of a hockey player? We can actually image that with the same technology and see how the wires do wire differently and have different integrity. If you're an athlete, you're wired differently than if you're an artist. And so same with aging, where now we can see how the roads deteriorate. We just have to have a few hypotheses where to look for. So are we looking at white matter wires involved in memory or in language? It turns out for Alzheimer's disease, these are the key spots for now that we're looking at. As opposed to, for instance, motor skills or vision that could be more important for another disease, such as Parkinson's disease, where we know that patients have motor skill issues. And so it's a new way. I like to call it, it's a new virtual way to dissect the brain and have a way to, have a virtual biopsy of these wires to really have a better idea, better specificity as what's going on and where is it going on and on which wires that affects which function. So, and that's the key, I think, for the coming years. It will be to really be more specific on what part of the white matter and what part of the brain is actually deteriorating with disease.
Tell us what's going on with the latest results from INmune Bio's clinical trial on AD patients, if you could.
Well, we've seen astonishing preliminary results. I've rarely seen this in my life. Striking changes in one key component of the disease is trying to get rid of edema and inflammation. And we don't know how to do this in the brain. Just like when you bang yourself or hurt yourself playing sports, you can go to the physio and try to get that inflammation out with ice and drugs. We're really bad at doing this in the brain. And what we're able to image now with this white matter disease is that the drug, the XPro molecule that's been administered on 8 Alzheimer's patients, is actually decreasing this inflammation drastically. Which seems to give back some of the function to the white matter to assure. And where we saw the biggest change was actually in the language connections. And so this is all preliminary, but working with some Australian neurologists and neuropsychologists and not knowing the patients, I was just looking at the data without knowing where and what it was coming from. We see differences in locations of the brain where patients really started to get better. And so that's extremely encouraging. And I hope that with the more, as we play with dosage and a higher number of subjects, we can really prove scientifically that this is working and changing the lives of these patients.
Well, where can we learn more online about Imeka?
We have a website, imeka.ca, where you can learn about the technology. We have a few YouTube channels, webinars online, and I'd be happy to answer questions via email or other conference calls. Well,
Doctor, I thank you so much for joining us here on Health Professional Radio this morning.
It's a pleasure. Thanks for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Maxime Descoteaux. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.